down to our next keynote. Pete Wendell's also been on our local team. You might have noticed I mentioned local teams earlier. In each market, we reach out to tap into some of the folks who are here in the local team, and he joined up like last summer sometime, a few phone calls. And so Pete is not only the user experience manager at Walgreens, but he's also involved with and co-founder of the Difference Collaborative, is it? And so he's going to talk to us a little bit about hidden in plain sight, some barriers to team engagement, really important stuff that we all need to pay attention to. Come on up here, Pete. And after this, we're going to have lunch, and it's going to be on the 9th floor. And again, we're going to be having table talks, discussions there. So big hand for Pete Wendell.
Green button. Thanks. Hi, good morning. Going to be talking about some things that actually affect your teams, people in your organizations that are there right now, and your customers. Basically, if you're human, this affects you now or it will affect you. So these two topics are topics that aren't necessarily talked about a lot, and they're kind of hidden in plain sight for some reasons that we'll discuss here. That is employee caregiving and mental health. A couple of hats, as Mark was saying, that I wear. I'm a user experience manager with Walgreens Digital here in Chicago. I work with a lot of the loyalty data to help understand behaviorally what people do and create connected platforms, products, and services for people to help them save money, get healthier, and care for their families. As having an interest within mental health and caregiving, been working with the Society for Participatory Medicine that has a branch here in Chicago that is looking to reframe how patients, providers, clinicians can work better together and share the right kinds of data. And because of some of the work and research that we've done through some of those groups, we formed a small group called the Difference Collaborative, which I'll articulate in a moment. So, as a user experience manager, a lot of what I do is really around helping people create better decisions for, again, saving money, caring for others, and becoming healthier. But that means that I'm working with people on my teams across the organization, whether it's researchers and it's engineers, it's marketers, it's customer experience folks, and helping them realize their potential. That's as much true internally as it is for our customers themselves. In order to build those kind of relationships and have teams that deliver and are connected and have autonomy and mastery and purpose within their environments, that means there must be a lot of trust built into it. In fact, that's Walgreens' kind of tagline, trusted since 1901. But a lot of people use that word trust in a lot of ways. So let's put a definition around that and be specific. For me, I kind of like Brené Brown's definition, who calls from Charles Feltman, trust is choosing to make something important to you vulnerable to the actions of someone else. What are people that you sign up for, what are they going to do with that data? What do you tell someone in confidence to say, not to say someone else, not to say that to someone else? What are they going to do with that? Trust revolves around the actions, the behaviors of other people. And you hope that people act with integrity in order to build that trust over time. Another big word, another lot of layers to these things that we use frequently, like integrity. So let's put some definition around that. Keeping with the theme of Brené Brown, as I think that she's on the right track for a lot of things, integrity being choosing what's right over what's fun, fast, or easy, choosing courage over comfort, and intentionally practicing your values and not just professing them. So it's doing a lot of the things to be able to achieve trust, including not only because it's good and ethical to do, but when I try and act with integrity, I do so because it's a demonstration of the kind of behaviors I want to see others in my team make. That means that I'm giving help, I'm receiving help, I might be asking for help in different situations. I've found, though, over the years that sometimes I'm better at giving help than receiving it. Sometimes it's hard to ask for help. And that's a bit of a felt difficulty for me as I reflected on some of the experiences I've had over the years, and that in asking for help, if you can't ask for help and your teams or the people that you're with can't reciprocate, that's not really a trusting relationship. in order to uncover some of the things that you need to have conversations about. Sometimes leadership and other people need to share authentically what's happening in their lives. So as a leader, we found that sharing your stories can serve as a spark to break down barriers, build trust, and help others act with courage and generosity and receptivity, things that you'd like to be able to have in your environments and on your teams. Well, let me be real about that for a moment then. As a leader, here's a story I want to tell to everyone here today. Other hats that I wear, I'm also a remote caregiver for an 85-year-old father with dementia. I'm a father of older kids with brain health issues, and a husband to my wife who's a cancer survivor. In spring 2019, here not that long ago, I've been going back and forth from where I live in Michigan to where I work here in Chicago, and seeing my son in East Lansing, Michigan at Michigan State, and going back and forth to Pittsburgh for some issues with the brain health. And as time passed, I was coming back from Iowa to help my dad after he had surgery and was suffering from some post-surgery depression and dementia flare-up. A week or so after that, my son ended up actually withdrawing from Michigan State University due to severe depression that we didn't really pick up on until we had a heart-to-heart. Followed by, some weeks after that, my wife having severe heart racing, SVT, supraventricular tachycardia, that won't stop, 200-300 beats a minute. So at one point we had to go to the emergency room. In the emergency room, as they're treating my wife for SVT, we get a call that a family friend, the same age as our kids, had just killed himself in college. A week before he would have graduated University of Detroit Mercy. So that's a lot of stuff. And I don't expect that everybody relates to all these pieces, and nor would I even expect in my life all these things would come to a confluence all at once. But what I found was that people connected with me, that they shared their experiences and they said, I have someone in my family going through this. I have a son, a daughter, a father-in-law who's experienced these things. What I found was there's a lot of things to relate to. And as I reflected on the experiences of what happened over time, I also realized, there's a lot of pain and learning and craziness. But as I thought about it as a caregiver, pain informs what I run towards, not what I run from. And I think that's actually true for a lot of caregivers. And as we look at what that means, you might wonder, well, is this going to be about a story about hope? Is this turning things around? Well, nope, not really, not quite. What we're going to talk about here is the fact that I'm not alone in this. And many people, even in this audience, are also affected directly by a lot of these things. So my frame of sharing today is going to be about the workplace, about the people you work with, about the teams that are there and what they're going through. We're going to look at some data today, and it's going to get a little geeky, and I haven't presented this a lot. So we'll be going fairly fast. And if people want to know what are the sources for this stuff, find me after lunch. I'll connect you with all the different places that this has come from. So I'm not alone in the fact that not only me being stressed in workplaces, workplace stress across the US is higher than it's ever been. Burnout is higher than ever. Gallup's measured 67% of employees saying they're always sometimes burned out on a regular basis. And 45% of workers 40 and under say they have extreme stress on a daily basis. Why is that? Well, there's a lot of reasons being discussed and put out there in the media. Increased workload, poor management, performance management is broken, more people are working remote and not being able to develop, social relationships and close relationships with people, but haven't a lot of us been experiencing these things for some time? Something seemed to be missing in a lot of this data. As we looked around and I talked with folks at these different institutions, it was clear that there are some things that were harder to identify and harder to talk about for people. Some things that we either don't easily recognize or that we don't easily want to admit to. That's caregiving and mental health in the workplace. Let's get real for a minute. Caregiving impacts the lives of 70% of full-time employees. Harvard Business Review just came out with a deeper study, a recent one this year, that indicates that more than 7 out of 10 workers are affected by caregiving in one way, shape, or form. That includes having kids, caring for an adult, having someone with mental health, other issues. And of those folks, 80% say that it affects their productivity. And 40 to 70% of those folks have symptoms of depression. Those are big numbers. Let's address the depression side, the mental health piece, really quickly. That overlaps, but it's its own problem. Depression alone costs business and society big time. 1 in 5 adults in the US experience mental illness in their lifetime. 1 in 10 has skipped at least one day of work in the past 12 months because of depression or anxiety. And 60% of adults with mental illness don't receive the mental health services that they need. That right now, today, at this moment, depression is the leading cause of disability in the US right now. 27% of people say they report serious difficulties in their work and life, and the cost to business in your organizations and our organizations is estimated at $62,000 per 100 employees. So thinking about that for groups that have 10,000 employees, other layers. And as a cost to the US, $210 billion a year problem. We're not alone in the US. By 2020, next year, depression is estimated by the World Health Organization to be the second leading cause of disability worldwide, and by 10 years from there, having a $6 trillion impact. So, these are big numbers. And what's interesting is that even more recent data says they might not all quite be accurate. Actually, 2018 mental health data in the workplace that came out that said things are actually differently worse, but strangely better than previously thought. Let me unpack that for a moment. Accenture in the UK did a survey of their workers there, 2,000 workers in the UK. 90% had been affected by mental health challenges. 85% reported a close family member being directly faced with health challenges, and 75% saying that affected their ability to enjoy life. 90% is a huge number. I mean, it was big from the US. But why? What's the jump? What caused that? Well, as a foreshadowing, there was an interesting layers as to why that was the case. For one of the facts that I might come back to here is 82% of those respondents from this survey said they're more willing to speak openly about mental health issues now than they were just a few years ago. We're going to come back to why that is. So let's back up about these people. Who are family caregivers and those struggling with mental health? What do we know about them? What impact is that having on their daily lives? What can we do about it? What are others actually doing about it to make a difference? Caregivers are many folks, but you may not know that 10% are age 75 and over, but 1 in 4 is a millennial. 15% of those people who are caregiving care for more than one person, and at least 1.3 million are age 8 to 18. What I didn't know, and I was surprised to find out, is that 20% of high school dropouts were left high school to care for a family member. These are a lot of issues that aren't really being addressed in an active way. And the mental health piece is certainly something that's rising, because as we look at the millennial caregivers, one in 4 of nearly 40 million caregivers, they are more likely to be caring for someone with emotional or mental health issues. What are they doing when they're caregiving? A lot, and it varies over time, over the situations that present themselves, from assisted daily living, bathing and grooming, to care coordination, figuring out insurance, transportation, medical care, meals, advocacy, meds. The list goes on and on. And the duration, sorry, the slide's a little off here, the duration of this is on average for about 4.5 years. the median is 5. If you're caring for someone with mental health issues, it's up to 8 or 9 years. This is a different problem than saying I've had a baby and I'm getting used to that, or I've had some life event that's changed and has an ending to it. It's tough to predict what the journey is going to be like here. 12 to 15% of people are caregiving for more than 10 years. That means there's issues to work with and understand at a human level and at an organizational level. So impact on well-being, some quick examples, of course there are many. Increased frailty, with the example here is spousal dementia caregivers experience increased unintentional weight loss, sometimes weight gain, exhaustion, weakness, sleep disturbances, fatigue, and pain, fairly common in those folks who are caregiving for folks with dementia. Also, people tend to engage in more risky behaviors. 30% of spousal caregivers using alcohol as a coping strategy, and 25% reporting more increases in smoking. And one of the big pieces is that because you're so busy working and addressing different aspects of your life, things drop off, like friends, like being able to connect with others. And that brings social isolation into account. Caregivers who live with their caree, the person they're caring for, are 2.5 times likely to feel isolated. And our friends down the road at University of Chicago a couple of years ago put out the data that was proven to be true around the fact that social isolation and loneliness is as dangerous to you physically as smoking a pack of cigarettes a day. That's what caregivers are going through. Now, it's not all bad, I should add, in that when people have the proper supports, when people are able to work through these moments and help individuals connect and thrive, they have an opportunity that they've shared around increasing their own sense of competency and mastery. They're able to get closer relationships to the ones that they're caring for. And they feel more like they have a purpose-driven life. They're giving back to something that really matters. These are things that are priceless moments, but they're also a little hard to achieve under many different circumstances. So let's unpack some of the issues here and opportunities. I do want to also talk about mental health because it's related and not quite the same. And because September is Suicide Prevention Month, and this will be in the deck that we share out, there's a crisis line available to anybody. If you text HOME, H-O-M-E, to 741-741, people will pick up and get you resources. Share it to anybody who needs it. Thanks. So one of the things that's complex with mental health is that it comes along with physical issues. And mental health issues can cause physical problems. Physical problems can cause mental health issues. We call those comorbidities a lot of the times. They come together. For instance, people with asthma have a 45% chance of being depressed. People with diabetes, 27%. And depressed people are 2 times more likely to develop heart disease or stroke and have 58% greater risk of obesity. That's complex stuff. I should also say that the primary care physicians, your family doctors, aren't necessarily trained to go and see all the potentials for mental health, especially with all these physical things going on. And so physical problems can often mask mental ones. What we see in workplace data is that 97% of employees who have depression and report depression also have other comorbid medical conditions. So usually if you have something, it's bound with other things. The workplace itself makes a difference too in what helps and what hurts these situations in a big way. Some work on looking at workplace culture and how it impacts different issues that people are having. There are trends that suggested physical health often affects absence more so. Mental health often affects performance. But in places where there's an unhealthy environment or a culture, where there's issues about trust, there's issues about odd communications and competitiveness, harmful and unsupportive work cultures experienced both higher absences and lower job performance. So there's something here at the cultural level, at the team level, that needs to be considered intentionally too. Let's jump to then barriers to address caregiving and depression in the workplace. what are the things that are preventing us to address this? One is that people don't want to self-identify. And this isn't on the content of the screen, but one is people don't consider themselves as caregivers. I'm just helping mom out. I'm just taking someone to the hospital. I'm just getting the meds. But that's caregiving, even if it's sometimes remote. Going back and forth and managing people, that adds up in time. And so this label doesn't necessarily fit what their identity is that they consider themselves as. But at work, thinking about the frame of work, those who identify themselves as a caregiver, or doing caregiving, I should say, or having mental health issues, they've actually reported real stigma in identifying those issues, with 54% of the people say they now lack challenging assignments. Half say they've gotten lower salary increases or bonuses, and 46% they no longer have a satisfactory career path. New York Times survey of stigma at work looked at 600 people, and 300 of those with mental health problems. 25% of those reported negative responses to their problems, including bullying and being passed up for promotions. And even the US Department of Health warns that discrimination can be a cost of disclosing these issues. Those are some tricky barriers. Other issues within the workplace are the cultures that are available now, and high performance culture, I'll label it, with poor performance management. What are your ways that you measure performance and engagement and impact with the people on your teams? We have groups that are, like in the technology industry, with startup culture, promoting person who gets in early and leaves the latest seems to be the one who's more ready for promotion. Not exactly a healthy thing to promote. And what are they measuring in order to get promotion? How much code was generated? How many software bugs you've squashed? How many emails that you've answered? It doesn't make sense. And though some have measurement of performance better than others, there's not a lot out there that's really clear. And that actually has ripple effects from a team culture standpoint. John Briggs, an author in looking at workplace metrics and performance measurement, calls this structural stupidity. People who do the work that they're being measured on, not what's good or right. In other words, that what you measure drives human behavior focused on the metric, not the outcome the metric is trying to measure. I bring this up because those metrics and things are making as much of a difference to you and your life at work and the people that are on your teams as the environment that it's in, as the technology that's being used. So, what is missing is that metrics and assessments often ignore the behavioral experience underpinning them. And that results in things like learned helplessness, people being unable to do anything differently, maybe pointing to leadership or company culture as the culprit, but that no one can do anything outside what's getting measured, whether it makes sense or not. That's the power that working with metrics has on behavior in the wrong way. Other aspects are complicated mindsets about how we ought to be or how we do address problems. And I'll frame this as complicated versus complex. Breaking this down a little bit, fundamental errors will result when people confuse complex nonlinear problems with linear problems. Might be defined more the linear problems being from procedurally focused people, looking at a single right answer, an algorithm. Rigid rules-based approaches that address complicated problems like solving a 10,000-piece puzzle faster, those don't work for systems-level problems like poverty or healthcare or other places that have so many layers of complexity. So what happens is you risk oversimplification and solutions that fail if you try and apply those methods and go faster. Making progress, managing mental health, and working one's way through unpredictable journeys of caregiving are complex problems. What I would suggest is that what do leadership value more as people look at the organizations that are their clients or even themselves? Do they value thinking or knowing? Thinking is a creative process. Knowing tends to be a retrieval process that suggests something about what is or isn't valued in the workplace. So beyond the barriers, then how might we intentionally design to increase positive change? And are there bright spots that are showing potential these days? There's a few. Here's a few brands that are setting some positive examples. Starbucks recently announced increased flex time for people to address personal care needs. And in Canada, they're moving their mental health support from $500 a year per person to $5,000 a year. And they're seeing that making a bet that it's going to be paying off. USAA has had a pretty strong track record for positive internal culture. They have leadership that shares their own stories about mental health, and they're actively building positive and supportive cultures from the top to the bottom. Prudential, in a similar way, with sharing stories, and Deloitte actually addressing additional paid family leave for caregivers up and beyond the Family Medical Leave Act, which they're legally required to do. So let's go back to that Accenture study, because I think that's an interesting bellwether for the future for what might be coming within organizations, how things might be differently designed. That 82% of respondents reporting they're more willing to share now about mental health than they were a few years ago. Here are some of the things that Accenture did to make a difference that may have led to people being more willing to share. First, they provided 24/7, free 24/7 confidential counseling, online awareness training, anonymous professionally managed chat services, and mindfulness and sleep improvement apps. They also developed Mental Health Allies program. They trained 1,700 staff of Accenture in the UK as mental health allies. That's 15% of the entire staff in the UK. That's a serious investment for people to embrace and understand what that means. The result of that was 61% of the people who spoke with someone at work about mental health issues say they shared their mental health challenges first with a close colleague. And everyone in the workplace has an awareness of mental health, and they're able to direct colleagues to available support. That's a big change for people in a lot of places that aren't able or don't have the trust or the ability to share that to start with. So other behaviors that make a difference, and certainly there's a lot here to talk about. I will reference just a few that, as we mentioned before, leaders setting the example. When they're able to share a story about what happened to them, others feel free that they're able to share it for themselves, and it starts breaking the ice for the culture. Skipping down to the one on the lower left, framing this as an opportunity around talent management, not just a benefit expense. That if you find a way for people to thrive in their organizations, and we stem the tide of what data is showing women in their 30s, 40s, and 50s leaving the workforce because of a lot of caregiving issues and related, you have an opportunity to actually increase the effectiveness of the people who are already at your company and to be able to actually realize opportunities for innovation that wouldn't have otherwise been there, versus thinking about how much are we spending on short-term disability. Part of this is a mindset thing. I will say that certainly offering direct counseling, health navigation resources are important, but flexing on roles and focusing on transitions, return to work. How do we think about dividing up and enabling people to work differently together to flex more to address these needs that are going on? And ultimately, these things point to not just a financial dimension of support, but a cultural shift. Both need to be mindfully designed. What we see still often being prevalent is groups that are focusing on wage replacement and costs of short-term disability. That's something we need to try and change. Groups saying we have an EAP system, an employee assistance tool, but a lot of what we're finding is employees don't necessarily trust it or are able to access it. And finally, there's a lot of wellness programs out there. And I'm not dissing wellness programs, but they don't act as a silver bullet. Some essential oils and exercise and rewarding for points doesn't come as an end-all be-all to these complicated issues. They work great in and of themselves, but they aren't a holistic approach to the problem. They can complement it, but they don't replace the issues. What we see looking at the data is that organizational behaviors need to be considered as a whole, from employees, leadership, human resources, technology, community partners, and program and service creation with, not just for, the people that are going to be using and consuming and potentially being healthier from those. You need a mobilizer at the center to intentionally design this, to intentionally research and to orchestrate this across different groups. One of the places to get started on this, I would recommend, if people are interested, a recent publication by Harvard Business Review called The Caring Company. It has a lot of the data, and a lot of references were in this previous slides, that give people some foundational starting point about what's the impact, what are people doing, what are the things that are seeing as effective, and it helps not only individuals, but also leadership reframe the problem from being a cost issue to a potential competitive advantage. Additionally, there are other kinds of communities and resources that are available to both people who need these caregiver mental health needs and people who are planning to support them within the organization. Online communities are prevalent and have grown in maturity and effectiveness over the past, especially the past few years. So these are places where people can go online, patients and caregivers, share and learn with one another, and they range from specific mental health areas like Depression Army and 7 Cups of Tea to dementia, such as Purple Sherpa Base Camp, caregiver sports through Caregiver Space, and even rare disease types with patients like me. I will say that there are other kinds of efforts that are underway now, like Dementia Friendly America, that's now available in 38 states. This is a space that doesn't only help people with dementia and caregiving, but it's also for libraries, for emergency departments, for chambers of commerce, for businesses that are trying to redesign how they intentionally create experiences, communications, and supports for people and families with Alzheimer's. This has grown about 80% in the past 3 years, and we expect possibly all 50 states soon to be joining this area. It's a toolkit freely available to anyone. Finally, one in real life community I might mention is Boulder Crest Institute. They started out addressing post-traumatic stress disorder for soldiers and found that between 2 soldiers who had the same terrible and traumatic experiences, one would get PTSD and one wouldn't. And they looked at the data for why. What they found that was the most common and prevalent and the most statistically significant difference was that it was high traumatic incidence of issues when those soldiers were kids were the ones that were coming back with PTSD, or high ACEs scores for those looking at those measures. Now they look at the ability to look at a moment of trauma that can actually be addressed by going back and seeing what happened back in the day as children, helping their families and caregivers, and even providing scaffolding support for kids. And they're seeing huge differences. And they've expanded their treatments and partnerships to go beyond mental health or go beyond PTSD to other forms of mental health. The reason I bring this up is that I think this is a sign for other kinds of communities that will be making big effects. They have a multidimensional understanding of people, culture, and systems to be able to make a difference, and the belief that trauma actually has the potential to help people grow with the right training, with the right scaffolding. Finally, one other piece of scaffolding or help is technology. I know people have seen AI chatbots and other systems. X2AI is a mobile on-demand system that's been out and available. It's modeled off of cognitive behavioral therapy, or CBT, which is kind of the gold standard of a lot of mental health therapy now. It's now being used in over 3 million conversations, has 800 different topics, some of which include specific forms for caregivers that was funded by AARP and the Canadian government that's seeing big differences. I'm bringing this up because one of the trends that we see in mental health and these other issues is that the demand is skyrocketing, and the amount of resources, clinicians, psychiatrists, others, aren't going to be able to fill that gap no matter what we do. Tech is a way to help fill that gap, provide onboarding, and connect people with resources in a way that might be more faster and amenable for people than trying to call someone on the phone to get a text from a human person. This is something that can be set up people for faster, more effective next steps, and it can provide ongoing support in those gap moments in time where there may not be a person available to call. And they're seeing actually big results on this. A whole range of studies, including here locally from Northwestern to many other institutions, showing positive outcomes, lowering cost, increasing quality. So that's a lot of stuff, and it's probably going to be the most different presentation you see today. But I have a question for you, the audience. If there was something 7 out of every 10 people on your team needed help with but weren't comfortable sharing or asking for help on, would you feel compelled to do something about it? I might suggest starting with increasing knowledge, starting with empowering yourself with what is happening, what's happening on my team, what are the impacts of this. We're just scratching the surface with this stuff today, but starting with what are the evidence-based sources that might point me in the right direction? And certainly reaching out. Reach out, connect, share, and learn together with people on your team, with leadership. Have a conversation about what might this look like, how might we be able to move in a direction that helps people connect. And finally, know this. Wherever you're at in this spectrum, you're not alone. We're with you. And including a new organization called the Difference Collaborative that's focused at the intersection of employees and employee caregivers. Thanks, appreciate the time.